My name is Kaufman West, and I'm an infectious disease doctor. I've been caring for patients with COVID-19 since the end of March, when we first had our patients into this area of the country. I've also been working with hospital and clinic administrators to write policies to keep our healthcare workers and other frontline health workers safe. SARS-CoV-2 is a virus that causes the disease COVID-19. SARS-CoV-2 is transmitted via droplet transmission mostly, and the risk of spread from aerosolization outside of the hospital is very low. SARS-CoV-2 does live on surfaces, but transmission through surfaces is not its major route. The major route is through droplet transmission. The way that droplet transmission works is that when a person has COVID-19, coughs and gets their mucus into your mucous membranes when both parties are not wearing masks. Because droplet transmission is the major route of transmission, putting your hands into a bucket of virus is not dangerous. You would want to wash your hands so that you don't accidentally transmit it from your hands to your face, but putting your hands in the bucket in and of itself is not dangerous. SARS-CoV-2 does not get under your nails, it doesn't seep into your skin, and it doesn't crawl up your arms. That's not the way that the virus is spread. Hand hygiene is extremely important, and washing your hands or using hand sanitizer for at least 20 seconds as recommended by the CDC is important. I would recommend that students in classrooms have their own supplies. So no sharing of crayons or calculators if at all possible. Things that cannot be individualized for each student, such as a laptop or other classroom supplies, should be cleaned and disinfected as per the manufacturer's guidelines for that supply or electronic equipment. Please be careful to know the quote-unquote wet time that the manufacturer of the disinfectant requires. The wet time is the amount of time that the disinfectant needs to stay wet in order to have enough time to be virucidal or to kill the virus. If you notice that a wet time is, for example, 4 minutes and the surface has dried before that 4-minute time is up, simply go over it again so that the wet time can be maintained. Masks are extremely important to prevent the spread of SARS-CoV-2 from one person to another. Masks probably do protect the wearer, but more than that, they protect the folks that the wearer comes in contact with. So masks are very efficient at keeping your own droplets to yourself, and that is essential to prevent the spread of COVID-19. It's important, especially in a classroom or in areas where there is a lot of communication, such as in the hospital. We've learned to talk louder, don't lower. So that means to just raise your voice so that you can be heard, perhaps enunciate and speak more slowly, rather than pulling the mask down to talk that way. Sort of defeats the purpose of trying to keep your droplets to yourself. I cannot say that the transmission rate within classrooms would be 0. I can't say the transmission rate at a grocery store would be 0, and I can't say that the transmission rate at a family birthday party is 0. We know the things that we need to do to lower the transmission rate as much as possible. That is number 1, wearing masks. Number 2, maintaining as much distance as possible, whether that's 3 feet or 6 feet. And also proper hand hygiene. We can prepare schools as best we can for reopening, but that must be coupled with continued, smart, ongoing community efforts to prevent transmission. That means keeping private events and gatherings to less than 10 people or so. That means wearing masks when you are going outside of the house, especially when you are going to be in close contact with people that are outside of your household. It's also important that parents with older children know where your children are, what they're doing, and who they're with. Not only is that important for contact tracing, should one of those friends become positive, but it's also important as we are finding that teenagers are just as efficient at spreading the virus as adults are. So please educate your teenagers and young adults in the household to be cognizant of this, to wear masks when they are out, and to also avoid gathering in large groups. Thank you.